Good afternoon, everyone. My name is Leslie Gaddis, and I'm one of the advisors here at LifeTime Asset Management, and I want to welcome you to this episode of our Lifetime Learning Series webinars. Today's topic is one that is personal to me and probably to many of our clients as well. We'll be talking about resources for helping aging relatives, featuring our guest speaker, Meike Wiest. Before we get started, I wanted to let you know that we welcome your questions. If you have questions now or during the presentation, please email them to info@lifetimeasset.com. We will try to address your questions at the end of the presentation, but if we do run short of time, we will answer you directly after the webinar has completed. Also, we are recording this session, so you can watch it later or share it with friends and family. So let's get started. We're extremely fortunate to have with us today Meike Wiest, who is a team lead at Arosa, formerly known as LifeLinks, which is an integrated provider of care management and home care services with locations in North Carolina and 7 other states. Prior to joining Arosa in 2012, she worked for more than 6 years as a targeted case manager in Wake County, supporting individuals with developmental disabilities and their families. Meike moved to the Triangle area from Hamburg, Germany, where she worked in geriatric care for 8 years. Born and raised in Germany, Meike first visited Raleigh as a high school exchange student when she met the man who would later become her husband. After completing her master's degree in social work, Meike moved to the US in 2005. She and her husband have 1 daughter and 1 very spoiled dog. Meike, welcome, and thank you for joining us today and sharing your thoughts and expertise.
Thank you so much for having me, and thank you for that introduction.
Oh, you're most welcome. We're very grateful to have you here. So to get started, question for you. The pandemic has put even greater pressure on caregivers, especially those in the sandwich generation who are caring for both their children and their aging relatives. What would you say is an important thing to consider as it pertains to caring for elders or supporting family members who are caring for elders in the midst of a global pandemic?
Yeah, I think that is certainly a question that is present in all aspects of our lives, and it has certainly become a huge challenge for us this past year as we work with seniors and family caregivers. I think especially the pandemic has shed light on the importance and the huge role that family caregivers play in caring for our seniors. And we have received so many calls of family members reaching out saying, normally I would do these things for mom, or I would travel to North Carolina from New York to help mom with this, or normally I would take her to these appointments, but right now I can't because of the COVID restrictions, the risks involved. So, it's shown us again, we know this is professional, but it's shown again how important it is to not go at it alone. And unfortunately, very often that tends to be the case, either a spouse or an adult child is burdened with this huge responsibility of caring for an aging parent, and mostly we're more than happy and willing to do it, but are not always equipped to meet all these various needs. So I think the one thing we've learned is that you can't go at it alone, and it's kind of a team sport, which I think why this topic that we're discussing today, how do you build a good team and what are some great supports to consider, is so relevant to our time.
Absolutely, and we're very, very much looking forward to your presentation and learning about some of these resources and tools that are available for us. So I'll hand it over to you.
Great. Well, I will share my screen and hope that goes off without a hitch. I am a care manager, as I was introduced, and we'll talk more as to what that means. But building a care team and bringing together resources for people that are aging, chronically disabled, or impaired in any other way, and their family support system or friends, whoever is in their lives, supporting them, is pretty much what we do. It's my job description. So that's what we'll be talking about today. Yeah, I'm going to talk about why it's so important to have a team and have multiple players on your team as you support a loved one, because it is very complicated. We are very fortunate, especially here in the area of North Carolina, in the Triangle area, to have a very resource-dense area. There are many choices, but sometimes that makes it even more complicated and makes it even more challenging to know where to go. And then too, sometimes you don't know what you don't know. There are so many resources and wonderful options out there that not everybody that hasn't been in this field is possibly familiar with or aware of. So that's a little bit what my focus will be today. The reason elder care is complicated is also because it is quite a fractured system that we work within. Oftentimes, as you age, your health becomes a more complicated matter. There are multiple doctors involved, possibly facilities, if a person resides in assisted living, for example. Communication between those different care silos, is what we often refer to them to, can be very poor. You know, the left hand doesn't necessarily always speak to the right hand, and oftentimes things fall through the cracks. Sometimes there's a lack of resources or awareness of resources to meet certain needs. And as people age and their families are starting to think about, you know, how can we best support them, folks oftentimes realize that Medicare and insurance covers very little of the supports that are needed as you age. And lastly, I mentioned here the domino effect. And what happens that oftentimes the people we come in contact with keep things going and hold things together, but then something happens and that event can just spiral things out of control. For example, a client might get a new diagnosis of diabetes. And so they're very uncertain about what they can and cannot eat now. And they, as a result, maybe are not eating correctly, are skipping meals, are not eating the right things. And then they might experiencing some numbness in their feet and they start having some balance issues. And so they might fall or they might avoid getting up. They don't want to go to the bathroom because they might fall, so they drink less. So, you know, you get my point. There oftentimes tend to be just a chain of events that spiral out of control, and then one smaller manageable problem can quickly become a larger issue and can become a real safety concern. So again, there's kind of a variety of factors that make aging just very complicated. So a reason to not go at it alone, whether it's as a spouse of a person that is aging, an adult child, because there's just so many multifaceted issues that oftentimes it's just too much for one person. So logically, having a team, having more hands on deck makes it a little bit easier. It's a shared burden, but also we all have different gifts, we have different strengths, and not everybody's equipped in the same way to help a person. So kind of looking at, you know, who do we have in our circle that can assist and what do they bring to the table? How can we best utilize them is part of what we're talking about today. And then that also speaks to the fact that oftentimes there are gaps in the care system that a person has that might have to be filled by a professional. And then lastly, too, it can be very lonely to be a caregiver. Oftentimes, having people that share that perspective, maybe in a support group, can be very helpful. Reaching out to other professionals for support can be important. So emotional support that is mentioned here on my slide speaks both to emotional support for the caregiver as well as for the person that is being cared for, but mostly it is to provide emotional support for the caregiver so they don't feel alone in this task. So again, surrounding yourself with your village, with your tribe that can help you is really important. And oftentimes that multidisciplinary approach will combine personal, natural supports with paid professional supports to really provide that comprehensive care that an aging person requires. So one tip that we use as we work with families and we kind of advise and coach them is to maybe create a roster. You really want to look at what are the needs, what are the things that need doing for this aging person, really identifying, brainstorming, what are the tasks that need to be accomplished, and then figuring out, you know, on this list, what do I like to do? What am I good at? What is something that brings me fulfillment? Then those are great tasks that a family member can take on. But then there are others on that list probably where you might need some help. It's good to be specific on these rosters. You know, tasks could be transportation. It could be emotional and just social time together. It could be tech support. It might be that this person really likes to be on the computer but has trouble with it, or really enjoys watching movies but has trouble navigating the system. It can be paying the taxes, managing money, coordinating appointments. There's all these things that as a person declines, they will need more and more help with all these wraparound tasks, which can be extremely time consuming. And then too, as you create your roster, we work with families to look at how often do these tasks need to be addressed, what is the need, and where are the gaps in that list. And then next you want to look at who are my team members. Hopefully there is more than one family member involved. And, sometimes that can be very difficult. I think those of us that have been family caregivers find that it can lead to conflict with others, as there tend to be varying opinions about how to care for a loved one. So coming together and really identifying who is good at what. And, you'll be surprised. Oftentimes there are many people that want to help, but they just don't know how. So being very intentional about utilizing them and their gifts can be a good approach. So looking at who are my team members, which family members are interested to contributing, even in the smallest way. Are there neighbors or friends that would like to be included in that plan? Are there professional care providers that need to be plugged in to fill the gaps? Certainly working with the financial advisor, people at church, attorneys, and lastly, maybe an aging life care manager like myself or a colleague of mine can be very helpful. And I'll speak to how that can be beneficial. But then once you have that list of team members, you can look at your roster and really develop a plan. And so sometimes it might be the neighbor and friend that wants to take mom to church on Sundays and do that. And then there might be a grandson that really wants to be the IT support or address any tech issues that might come up. One of my clients, it turned out that she loved her grandchildren and they loved her, but with increasing dementia, they had trouble communicating. But they ended up scheduling a day where the grandkids would come over and they would play on the Wii, and the grandkids would facilitate that, and they would play Wii bowling and Wii tennis and have a great time together. So it's a way to kind of think outside of the box as to how to come together to care for this person. And then once, transportation needs, all those kinds of things we talked about, if all the natural supports have been used up, then that leaves those gaps where a professional care provider might need to step in. And an aging life care manager such as myself can help create that care plan and kind of get you connected with these necessary supports. And aging life care manager is a strange term. Many people look at me and say, "You're what?" And it's a newer term that really means care manager, geriatric care manager. It has been coined an aging life care manager as part of an attempt to separate us from the term care management that is used so broadly. Oftentimes people will say, well, I already have a care manager at the hospital or with my doctor's office, with my insurance. Why would I need you? And an aging life care manager is somebody that is really a holistic manager of all things involved with the care of the person. And typically we're social workers by training, like myself, or nurses, gerontologists, or other healthcare professionals that have worked in the field of aging for the majority of their career and have really made this their specialty. And we are usually receiving special training, have a significant amount of experience in the field. And aging life care managers are part of something called the Aging Life Care Association, and that is a national association of care managers that are working toward really legitimizing this profession, creating some code of ethics and standards of practice around it, because it is a private pay service and it is quite costly. And so you want to make sure that when you hire such an aging life care manager, that you get your money's worth. So, you can expect in any market to pay between $100 and $250 an hour privately out of pocket for such an advisor. Some markets like New York City, they even cost up to $400. Here in our triangle area, usually around $100 to $125 an hour is kind of the going rate. And the reason I say on here, do your homework, is because really anybody can call themselves a care manager, but not everybody has really the expertise to do the work that we do. So we encourage people therefore to really interview the care manager that they're looking for. And we do encourage to work with somebody that is part of the Aging Life Care Association, because it gives you some peace of mind that they have been vetted. And in order to find such an individual, this is just a slide to kind of show you what the logo looks like that is associated with members of the Aging Life Care Association. So you would see this logo on their website or maybe their email signature, and you can certainly ask any potential care manager that you're interested in working with if they're a member of the Aging Life Care Association and what their affiliation is. The Aging Life Care Association has a website that you can go to that was listed on the page before. And on that website, it's here too, aginglifecare.org. And on that website, you'll see an orange button, such as the one pictured here, that you can click on. You can enter your zip code, and it'll spit out a list of members in that area. And it'll tell you about their level of experience, their level of training, what is their background, what type of services do they provide. And it'll give you just an opportunity to review the professionals available in your area and to find a good match. When to bring on an Aging Life Care manager is what I wanted to talk about next. You know, I think as things become more complicated in the care of an aging loved one, at some point, people notice that the concerns that are occurring are just going beyond their expertise. It's just becoming too complex, or they're just questions that you don't find easy answers for. So anytime that happens, we encourage folks to reach out to an Aging Life Care manager. In general, if you're exploring your options and you need information, it's a great utilization of a care manager. They are out there, they work with various providers and facilities in your area, and they can steer you away or toward providers that might meet your need. They can connect you with all kinds of professionals in your area that you might not even be aware of exist, and can, you know, help you fill whatever gaps you have in your specific situation. You know, oftentimes we connect families with specialists, physicians, to really address their loved ones' concerns. Not every primary care doctor is properly equipped to address certain dementias or certain diseases such as Parkinson's or MS or other things. So we can really steer you toward professionals that are going to be best trained to help your loved one. We oftentimes help with placement assistance, looking at the option of staying at home versus going into a facility, helping families weigh the pros and the cons of each option, the cost involved, and then two, what is the appropriate level of care? Very often families come to us and say, well, mom needed help, and, you know, we started an independent living facility because it was cheaper and that's what mom wanted. However, it was not the appropriate level of care, and soon problems arose, and then you have to move again, and there's more cost involved with that move. So oftentimes involving somebody on the front end to really help you assess which is the appropriate level of care, what are the limitations of each level of care, and then making that determination and finding the right fit for your family based on budget, priorities, what kind of lifestyle does this person seek. All those things, you know, a person can save you a lot of time and trouble and missteps along the way if you have this professional advisor by your side. Looking at things like volunteer opportunities, how do we create an engaging social environment for this person, is a great use of a care manager. Right now with COVID, that is certainly very, very restricted. But even in this environment, there may be some options that a care manager can make you aware of and connect you to provide a higher quality of life for your loved one, and then also some respite for the family caregiver. I think that is something that is huge. We talked about the toll that caregiving can take. So creating opportunities for respite. There are oftentimes resources out there that will pay for respite. We oftentimes connect people with vouchers, with free programs for respite. So there are lots of opportunities out there that caregivers may not be familiar with and aware of. Looking at the home, mom really wants to stay at home. So really looking at how can we make that happen safely? What means do we have to work within? What is the budget? But then looking at safety in the home, looking at accessibility of the home, and looking at what are the supports that are needed to maintain mom or dad at home safely, and putting that plan together. The care manager can help you with that. Looking at daycare options to maybe, again, allow for a person to stay in their home, but then have something to do during the day and give the caregiver some free time. It's a very underutilized resource in the community. So that's something that we work with. If there's no money for such a private adult daycare facility, we look at programs like PACE. PACE is a Medicaid-funded program that, if eligible, there's some eligibility requirements, but it can be an option to get extra funding for supports. The same is true for VA aid and attendance support. So if somebody has served in the military or is the surviving spouse of somebody that has served in the military during any of the big wars, again, there's eligibility criteria, but we can assess if the person may be eligible for some funding through the VA, and then get them connected to the right people to get that ball rolling and get that application process going. So lots of great resources out there, and a care manager can help identify which ones would best fill the gaps in your need, in your situation, whether that might be transportation needs, whether that might be medication management issues, that could be support groups for the caregiver, whatever it might be. Usually there are very few problems that we haven't come across before. And just like in so many other areas, you don't have to reinvent the wheel and kind of go through all the trial and error and possibly get burned a few times if you have somebody that can help you create that roadmap. So that's really the huge benefit. But then also you see here too, family has, the client may have little support or no local family. And that's a big referral stream for us is long distance caregivers. And we'll talk about an example of that in a little bit here. And then too, we oftentimes get the question, well, there are places online that I can call for free. We remind people, free advice is usually not free. Oftentimes, places that might refer you to a residential placement, they get a kickback from the place that they refer you to, or they receive some kind of a reward. And one of our ethical baselines for our service is that we never receive any kind of a kickback or a referral fee for anything that we do, because we are privately paid. We work exclusively for our client and for what's in their best interest. So it's unbiased advice and unbiased information, which can be important. We talked about the disagreement that can arise in a family when you're caring together for somebody that is aging. Having somebody that can come in as a buffer and a mediator can be huge. We oftentimes work with families that struggle, and families come to us and say, oh gosh, you won't believe what we're going through. And oftentimes, we've seen it many times before, nobody is alone. Families are complicated, just like aging, and caring for a loved one makes that even more complex and can kind of exasperate these issues. And then too, just oftentimes we work with families through changes. We might work with the family, things are stable, we fight back, we fade out, but then down the road something changes, there's a new diagnosis or a change in need, and you can pull that person back out and help you kind of navigate this juncture and readjust your plan and get back on the right track. And then lastly, on year, sometimes we get involved if there's concern about abuse, neglect, or exploitation. And so we can come in and assist, do an assessment, again, from a third-party independent perspective, and see if there are any concerns that need to be addressed. So that is another use of an aging life care manager. If you do work with somebody like myself, usually what you can expect is that you will be able to have a free consultation where you can kind of present your situation, and the care manager should be able to explain to you how they can come in to assist you and figure out if it's a good fit. And this is a great place for you to really do that homework that I talked about, find out, is this a single practitioner or is this a larger practice? I work for a larger practice and I really like having a multitude of coworkers that I can pull in with their expertise as needed. And also, working with a larger practice, if your care manager is on vacation, there's likely somebody else that can be a backup. You can ask about, what is your after hour or on-call system? Do you have somebody that is available 24/7, which is usually desirable for a care manager? So that is a good question to ask. Questions about fee structure, what does the service agreement look like? Some practices offer some kind of a subscription plan, or more often you will see an hourly type service agreement. Now, this is a great place to ask all these questions, figure out, who do you have access to? What other services does this agency possibly provide? So some agencies like myself, like at my agency, we also have a home care arm. So we may be able to assist there. We also have a guardianship program, or so, various programs might also offer therapy or other connected related services that you can take advantage of. So exploring those questions would be a good thing to do during the consultation. And then once you come to an understanding that this is a great fit and you want to move forward, then once you sign a service agreement with that provider, things would go into the assessment phase. And the assessment can be with the adult children, it can be with the client themselves, it can be with the whole family. Really, it's kind of decided on a case-by-case basis. But this is a good opportunity to really bring all those needs to the table and do care planning. And the care planning that results from this assessment then leads to a care plan implementation. And sometimes families choose to take that care plan and run with it and do all the work themselves, or a care manager can stay involved and then help coordinate those services. Especially Leslie mentioned the sandwich generation. Many of our clients are not only caring for their parent or their adult family member, they also still have children and a job and all these other responsibilities that they're juggling. So sometimes, families choose to outsource certain things. So instead of taking PTO to take mom to the doctor every couple of weeks, the care manager might take mom and listen with a professional ear and then make sure that information is relayed to the family and follow-up steps are implemented. Care manager might come in and arrange home care, to have somebody come in to help with cleaning and bathing, and then they can come in and address any issues, coach the caregivers if there are concerns. So having that care manager involved in all aspects can be a good investment sometimes. Here it just lists again kind of the different areas. Again, the care manager comes in from a holistic perspective, and those are the areas that we're looking at. Health and disability certainly is our primary, making sure that the healthcare needs are met, making sure that the home is safe, making sure that there are no unmet needs in that arena is crucial. Financial is not so much that we are managing anybody's finances, but getting them connected with somebody that can help with financial planning, or maybe daily money managing. Maybe it's just a matter of paying the bills. Bringing in a daily money manager can be a huge benefit and can be a huge help, or connecting them with a great CPA that can assist. Whatever the financial concerns might be, we can come up with a solution. Housing would pertain to the staying at home or finding a facility and figuring out which plan is best and how to address that. And then navigating the family tension, filling the gaps by plugging in other local resources, and then advocacy. Again, being that voice for the client, whether it's in a medical situation, whether it's at a facility because they're not getting the care that they might need, looking, advocating with doctors, making sure they are all on the same page is huge. So advocacy is probably the other big leg of care management. The legal tab here speaks to us reviewing with the client, do you have your legal matters in order? Do you have a will? Do you have your advance directives in place? Have you named somebody as your healthcare power of attorney and financial power of attorney? If not, we will educate and advise as to why that is so important. That is a huge area of need that we stress with our clients. And if that is something that they need to get in place, we can connect them with the appropriate legal professional to draft those documents, an elder law attorney that is, or estate planning attorney that is skilled in that area and can yield the best results. And then there's counseling and crisis intervention. And, the counseling we spoke about, it's more, not so much a therapy counseling, but the counseling in decision-making and next steps. And then crisis intervention, unfortunately, is oftentimes how we first become involved, because people wait to bring us on board until there's a pressing need. So rather than people reaching out proactively and putting this comprehensive plan in place, which is how we love to operate, unfortunately, most often we get a call because mom has fallen and is in the hospital and they're pressing for discharge, but she's not ready and she can't go home. And what do we do? So unfortunately, that's oftentimes how our relationships get started with clients, and we're happy to do it. But we very much love people like yourself that come out to get educated and try to be proactive and putting a plan together and getting people in place that can help you in case of a crisis. Because we all know we make better decisions if we're prepared than making decisions in a crisis type situation. So that's just my little PSA. I want to give you a couple of examples as to how people have used us. And this is certainly a huge one. A person reaching out about a family member oftentimes that they're concerned about, that they need assistance with. So an example that I wanted to give was a recent client of mine who the daughter reached out and said, I am very, very concerned about my mom. She has been declining. She has not enough assets to really pay for any kind of an assisted living, but that is the level of care she needs. But she doesn't have a small enough income to qualify for some of the public funding sources through Medicaid that are out there. So what do we do? And so we worked with this mom, assessed mom, and found that she had very significant care needs. And at the time she was at an assisted living that the daughter subsidized but couldn't continue to subsidize. And they were saying she actually needed a higher level of care and wanted to discharge. And so they were just at this impasse. And the financial advisor they were working with said, well, she needs to go into a skilled nursing facility because then Medicaid will pay. However, she didn't meet the requirements to go into a skilled nursing facility. So this family was just at their wit's end and wasn't sure what to do. And we were able to find a family care home, which is a smaller assisted living under the same licensure umbrella that is out there. And there's small homes that are licensed as an assisted living facility, but only have about usually 4 to 6 individuals that reside there. And they oftentimes can be negotiated with regarding fees. So we were able to find a home that was willing to take on the care for this woman at her budget level. And she discharged there and has been there very successfully now for 2 years. Before she was in and out of the hospital, there were lots of complications. And now in this smaller environment with a lower staff to resident ratio, much more oversight, this has been a great arrangement. And then even through COVID, where larger facilities would not allow visits, in this smaller environment, the family was still able to have access to mom and visit. And that's been a really good thing. And she's actually now at end of life receiving hospice care in the family care home and will likely be able to pass away there with family by her side. So it's really been kind of a wonderful care story, a family I've worked with for a few years now, and seeing them kind of come full circle and the positive impact we were able to make there to make daughter's life less stressful, to get her the care she needs within her budget. And I've stayed on board to help the daughter, who is still working, with some of the coordination and making sure that everything is going smoothly and addressing any kinks in the road. So that's been a really nice success story, so to speak. This was just kind of how we assisted in that case. Another, again, we talked about the long distance caregiving, and this is a huge, huge area of need. We have so many long distance caregivers that, oftentimes travel, have to take time. They want to be there for their loved one, but it's not always possible, especially in case of an emergency. So that is an area where we can be very useful. And as an example, I want to share a story about, again, a woman that called me regarding her mother that lives here in North Carolina. The daughter lives in New York, and she reached out and said, Mom is in her own apartment, and she's been receiving some home care and some supports, but it's just becoming more and more complicated. She's now developed some dementia and is refusing the help, is sending the caregivers home, is not taking her medication correctly. And so I started working with them. The daughter flew back and forth all the time. It was causing strain on her business. And so I kind of became her boots on the ground and her eyes on Mom. And rather than being concerned, she could call me at any time, say, "Oof, something's going on. Can you go over there and check?" And so I started going to her doctor's appointments, started coordinating the home care. When it became time to increase home care, I was able to guide the daughter on that. And eventually down the road, it really became very clear that the home care was not a safe option anymore because of medication complications, frequent falls, and it became necessary to place her in an assisted living facility for financial reasons too, because 24/7 care at home was becoming too expensive. So then finding an appropriate assisted living and facilitating that placement process, knowing all the forms to fill out, knowing what the doctor had to provide, and then coordinating with the senior move specialist. It's another great underutilized resource. There are actually people out there that really specialize in relocating seniors and downsizing and how to take care of the estate, how to help a person really consolidate their belongings and only take what fits into their space. They're very emotionally savvy in how to help that senior with the grief process of downsizing and moving out of their oftentimes long-term home, and how to involve them in the downsizing process and the weeding out process of things. And then usually they create a floor plan for the new environment and try to make it as much as home as possible. And so this was a really great story where that was a wonderful reveal, where Mom was so nervous about that move and the downsizing, but then seeing her new space and how home-like it was and how familiar it already felt, it kind of eased that blow of the transition. And now I'm still involved in visiting her in the facility, because even though you think in assisted living, you're paying this outrageous price and it should take care of everything, fortunately, that's not always the case. So we always encourage having eyes on the person. And since daughter lives in New York, I go out there and I pop in unannounced. I make sure that Mom's nails are clean and that her hair is done and that she doesn't have food on her shirt, and that she is able to participate in activities. And so making sure that all those things that are done that normally maybe a child would do if they could, we can be those boots on the ground, as I mentioned, and be those eyes on the person. Again, the monitoring of the client here, keeping the family informed, keeping kind of an ongoing evaluating eye on the person to make changes as needed. That's what we do in those types of situations. And then lastly, another important way we are utilized is usually when a person ages and becomes what we call either a solo senior or an elder orphan, or there's all kinds of terms, and some people like some more than others. But sometimes it just happens that the person either didn't marry or becomes a widow or widower and there are no children. Family oftentimes is scattered or estranged. So there are quite a few people out there that just don't have that support as they're aging. And so having a care manager that they have an established relationship for can be very comforting and can also ensure that they can live safely at home the way they might want to for the longest time possible. So here again, being that advocate, being that support, being able to step in. And again, here we also look, are there friends we can pull in? Are there volunteer resources we can pull in? Can we connect them with any other resources out there? We don't do it all, but we can be the person that can help this individual create their support network and surround them with all the necessary supports. And then being there in case something does go wrong, that's oftentimes a huge worry for people aging alone is, what happens if something happens to me, or will anybody notice if something happens to me? So being that person can be a huge source of comfort. And then lastly, I just want to mention a couple of reasons people might shy away from care management, which is, oftentimes we want to do it all ourselves. We want to be that person that is there for mom. Mom was there for us and took great care of us. We want to do the same for her. However, like we talked about, you can't do it all yourself, and it become overwhelming. It can become a source of burnout. And then realistically too, we're just not good at all things. So doing the things we're good at and then outsourcing the rest is usually advisable. And then two, we notice that clients that come to us, it's kind of, you fix one issue at a time, you put a Band-Aid on it, put a plug in it, but then it ends up spiraling out of control. So bringing in a care manager that can take a holistic look and that can oftentimes already see the writing on the wall and point out potential issues and potential things that might go south can help prevent those from ever becoming an issue. So really looking at a holistic picture and creating a holistic plan to attack the issues is advisable. And then two, we talked about reacting in a crisis rather than being proactive. And that's what number 3 speaks to. Again, mom needs to be discharged from the hospital ASAP, and let's just get her out of there and put her in this facility. And then it turns out to be the wrong choice. Those are the kinds of issues. So having that established relationship with a care manager already, and you can just pull them out of your back pocket as needed, can be very helpful and can be a good thing. Or doing your research about, what resources are out there, what are options before an emergency happens is what we're always advising. And then two, doing it alone, as we talked about, can just be extremely stressful. It can be isolating. It can be costly, not only financially, but also just costly for the relationship, costly for our mental and physical health. There's lots of studies that caregivers oftentimes have health complications, die earlier. It's a hard job to do alone. So really creating that support network is key. And I'll close with that. It is what we do. Aging is complicated. There's lots of great solutions, great resources, and just finding that person that can help you create that plan is key. And we encourage you to not ever hesitate to ask for help. If not a care manager, then your community. And close with my information here. I noticed in my beginning slide, I was Meike Wiest, which happens often. I'm Meike Wiest with an I in there. And you're very welcome to reach out to me with any questions, any concerns, and I'll be happy to hopefully point you in the right direction. And hope this was helpful, and give it back over to Leslie to see if there are any questions that we might want to address. And I'll unshare my screen at this time.
Okay. Thank you, Meike. That was great. We can't thank you enough for taking the time to share this information. You definitely shone a light on how complicated this topic is.
Yes.
But also the wealth of resources that are available if you're just aware of them, and that's something your organization can help with. And that's why we started this Lifetime Learning Series, is to share information, to help our clients prepare. We're planners too, so
absolutely, yes.
Believe in having a plan. So on a personal note, my family engaged the services of your organization to evaluate my 97-year-old grandfather's living space for safety and accessibility. And I was surprised to learn the resources that are available and covered by Medicare. I mean, it doesn't cover a lot, but there are things that it does cover that were surprising, such as having an occupational therapist observe how a person gets in and out of the shower and then make you recommendations for where to place grab bars or what other safety measures. What other services? You mentioned a few services, but are there any others that might surprise people? I know you mentioned the respite vouchers and
I peppered a few in there. There's certainly, I mean, there's such a wealth, though. It takes years of being in the field to really learn all the research, and it changes all the time too. You know, it just, there's more things popping up. I think along the line, the OT is certainly your best friend. And I think that is too, not just regarding the accessibility and safety of the home, but they can also oftentimes help with small cognitive assessments. Many occupational therapists can come in and really assess a person's cognitive functioning level, and then recommending ways to communicate with that person. They can do communication assessments to see what is the best communication style for this person. Do they maybe communicate better visually than verbally? Or, you know, those are also levels they can address. The speech therapist can not only help with speech-related counseling, but also with swallowing issues, with dietary issues. So oftentimes people are very surprised that that is something a speech therapist can assist with, dietary concerns. So that's a big one. I think one thing that we oftentimes work with families with are community pharmacies. They're a wonderful resource. I think many of our clients say, well, but I've been with Walmart Pharmacy forever, and that's connection that's important. However, there are small community pharmacies that will offer free medication delivery. They will offer adherence packaging for free, where they actually, a pharmacist pre-packages medications, color coordinated, labeled by time and time of day, so it can prevent medication errors. And can, you know, so many seniors end up in the hospital because of medication errors. It's a huge concern. Or not being able to get to the pharmacy to fill your medication. So community pharmacies, I can't toot their horn loudly enough. That's a big one. And then too, I think technology is a huge market. You know, there's so many wonderful technological programs, opportunities to monitor safety of a loved one, monitor vitals, monitor all kinds of things. I mean, there's unending opportunities there. So working with an assistive technology specialist can be huge. So those are some things that come to mind, kind of as things that we oftentimes find people are surprised.
And it's interesting you should mention the technology. We'd actually had somebody scheduled to talk about the MIT Age Lab and technologies right before the pandemic and everything shut down. So we're looking forward to scheduling that again at some point. But
well, and I think right now, especially with the pandemic, those things are even more important, you know, because you want to avoid doctor's visits if possible, or you want to avoid having to bring people into the home. So some of those technologies can take the place of some of those services, and certainly can keep families connected too. Right now, where we're more long distance, so finding technology that works for seniors. We have certainly found in our line of business that a whole new branch of our business has become helping seniors with telehealth appointments, because everybody wants to meet via telehealth, but a lot of our seniors are really not able to navigate those systems and do that. So, you know, there's certainly technology, there's so much potential, but then finding a way to make it palatable and practical for our seniors is a huge area, I think, where we'll see more and more change and improvement.
Yeah, I mean, you see that with the, you know, signing up for the COVID vaccine, where seniors don't, you know, have to go on Duke My Health Chart, but some people can't figure that out. So,
yes.
And one other question, so that came in, my parents don't need help yet, but I want to be prepared when they do. What steps should I take now? And I know that could be a whole nother webinar, but just do you have a few quick bullet points? Suggestions?
I think the most important one, and I touched briefly on it earlier, is to, you know, while mom and dad are still well and able to have important conversations about what do they envision for their retirement years, for their aging, talking through scenarios such as, if you do develop a dementia, what do you want us to do? Really they're not fun conversations to have, but having those conversations and maybe asking mom and dad to put things in writing can be so helpful as they do decline. And then two, to make sure that advanced directives are in place. So making sure they have their healthcare power of attorney and their financial power of attorney, a living will and a will in place, so that if something does happen, that their decision makers that they choose are equipped to actually be able to step in and fulfill those tasks. I think that's the biggest thing you can do preventatively. And then to researching options, educating yourself, going to events, getting connected with your senior center maybe, or kind of exploring what they offer. And then two, possibly meeting with an aging life care professional, seeing on the aging life care website who's in my area, and maybe having that conversation and getting on record with them, so that if something happens, you already have that connection, you're already established with that firm. And usually there's no retainer, there's no sign-on fee. It's really usually an as-needed service. So it doesn't cost anything, to get to know somebody and get established, so that they're already in your back pocket if something is to happen.
Those are great tips. Thank you. And so thank you for answering those questions. And to those of you who submitted questions, thank you for engaging with us during the webinar. We're about out of time, but if you have more questions for us or for Meike, please don't hesitate to contact us. You can email us directly, or you can get in touch at info@lifetimeasset.com. We will post the recording of this session on the website within a week or so. So you can check it out there if there are things that you need to rewatch. And we've got more great webinars coming your way. The current schedule is the first and third Thursday of the month. So the next scheduled webinar, the topic is mortgages. And specifically geared towards first-time home buying, featuring Dan Flynn. So don't miss that chance to learn about first-time home buyers should know, including what you can expect from the process and how to help ensure a good fit for your long-term plans and financial goals. And that will be on March 4th. Again, thank you for your time today, and especially Meike for sharing her expertise with us. And we will see you again next time.
Thanks for having me. It's a pleasure.
Take care. Thank you.